doctor saying such a thing. But that's where the AMA, well, I think a lot of doctors these days, and of course the AMA, they were all behind the HMOs when Nixon and that whole thing started in the 70s. But doctors now are amongst the most demoralized people in this country because they realize they've been given the shaft by the insurance company. And what used to take one person sitting behind the glass when you went into the doctor's office, filling out the forms, and there's now 5 or 6 people back there arguing on the phone with the insurance company to get a $15 bill paid. How much is that costing us? Well, actually, there's statistics. We know how much it's costing us. The overhead goes up to 30% of a health insurance company's budget. 30%. It costs for overhead, red tape, bureaucracy, paperwork. Now, when I did a little thing out on the street, and I just stopping people, and I said, now, you know, these private health insurance companies, they spend up to 30% on overhead and red tape and all this. What do you think the government spends on their bureaucracy, their paperwork for their health program, Medicare and Medicaid? And people would say, well, let's see, if Aetna and Kaiser is spending, you know, 25, 30%, well, it's got to be 40%. The government's doing it, right? The government's got to be 50%. I said, no, it's 3%. That's how much it costs to run Medicare and Medicaid. 3%. You know, in Canada, they run their entire free universal health care system. Total overhead, total bureaucracy, 1.7% of the total health care budget. We have listened to this for the last 30-plus years about how the federal government is bad, state government is bad government, bad, you know. And it's like, how did we ever cop the attitude that the government of, by, and for the people could be bad? Because the government's us, and we're not bad. I don't understand this. I don't understand, but they've done a good job, haven't they, convincing the average American, you don't want to get the government involved. When somebody says that to me, you know what I say to them? I said, you know, really, you don't want the government involved? Ask your grandparents if that Social Security check comes every month. And it not only comes every month. My dad says it comes on the same day through the government-sponsored U.S. mail. And remarkably, it's the same amount every month. They actually get the check right. How do they do that? Tens of millions of seniors every month get a Social Security check on time for the exact amount. The American people have fallen for this myth that government is bad. It's only as bad. I heard Al Franken say a couple months ago. He said, you know, the Republicans, they run on a platform of the government is bad, it's evil, you don't let the government run things. And then once elected, they spend the next 4 years proving themselves right. You know, this whole thing, what you're attempting to do here in this state, I read a story there, Blue Cross of California is already promising to spend $2 million. I'm sure they'll spend a lot more than that fighting you, because this is the last thing that they want to have happen. And they're going to fight this because, and they're going to try and scare people. Socialized medicine. Ooh, socialized, bad. Really? Isn't that what our police departments are? Socialized, run by the government, free service? Do you think anybody would ever ask if the fire department should have to post a profit? You know? You think, I mean, seriously, would we allow a fire department to, every time they get a call for a house fire, when they arrive at the house, determine whether or not this is going to affect the fire department's bottom line? We wouldn't allow that, would we? Well, when someone is wheeled into a hospital, that question should never be asked. Never. That's an immoral question amongst in a humane society to ask that question. Where's the profit here? How is this going to affect our bottom line? How are we going to make money off this sick person? I mean, this doesn't look good, folks. I mean, it doesn't look good to the rest of the world, and it won't look good to the anthropologists who dig us up hundreds of years from now. They'll wonder, what were these people thinking? What were they? In closing, I want to say that we spent a good deal of time in this great state in making this film. Unfortunately, it was for all the wrong reasons. It was following the plight of people who couldn't pay their hospital bills at a Kaiser-owned hospital and dumped on Skid Row in downtown Los Angeles in their hospital gown to wander out into the street, not knowing where they're at. It was following Blue Cross of California and how they, after someone had an expensive operation, tried to get them knocked off their rolls. They hire private investigators to dig up anything they can in people's past to get them knocked off or to repay the bill for the operation. You'll see in one scene, the most ridiculous scene in the movie, where a woman who had Blue Cross of California, she had an operation. It ran around $7,000 for the procedure. Blue Cross paid it, but then they sent out their investigators. Find out what you can on her. We don't want to pay this $7,000. You know, we want try and get the money back if you can. And they found out that years earlier, this woman had had a yeast infection. And they, yes. And they then demanded the $7,000 back. I'm surprised they didn't find that she had sneezed 10 years ago into a Kleenex somewhere. I mean, they're laughing, but this is a true story. This is what they do. And you're going to hear other testimony here from people, two from the Los Angeles area and one from Kentucky. And I'll let Donnell tell her story of what happened. And when you hear these stories, these aren't anecdotal stories. These are stories that are representative of the evidence that exists. And the evidence says that we lose 18,000 Americans every year simply because they don't have a health insurance card. We don't, and how many thousands we lose because people are, even when they have insurance, can't afford the co-pays, can't afford the deductibles. You'll see at the beginning of the movie, a couple, one woman is an editor of a small town paper. Her husband's a machinist. They work good jobs. They're middle-class people. And they end up in their 50s living in their daughter's basement because they've been bankrupted by medical bills. And they had health insurance. They had health insurance. The co-pays and the deductibles alone bankrupted them. And the premium, jacking the premium up so high that they could no longer afford to keep their own home. That should not be happening in the United States of America. It's a crime. And I believe that these insurance companies are a criminal racket. We allow them to exist legally, but I don't think they should. And I think they've got to be removed from this process. And I sincerely hope that California will take the lead, as you have done so often in the past, when the rest of the country has to be brought along kicking and screaming. You know, it was you that decided that people shouldn't be paid $5.15 an hour as a minimum wage. That was this state. It was this state that said we have to protect our environment and demand that the automakers put devices on cars to cut down on pollution and global warming. That was this state. And you've done so many other things like this. Lead the way again for this country. Be a shining beacon of light for what America has to do. Remove profit, remove the insurance companies from this, regulate the pharmaceutical companies like a public utility, strictly regulate them, and guarantee health coverage for all Americans and all the people in this state. Thank you very much.